Salmeterol is a long-acting beta-2 adrenergic receptor agonist used to treat asthma and COPD. In this video, let's found. What is salmeterol? What is salmeterol used for? Contraindication. What are the side effects of taking salmeterol? How does salmeterol work? How to use salmeterol? What is salmeterol? Salmeterol is a long-acting beta-2 adrenergic receptor agonist used in the maintenance and prevention of asthma symptoms and maintenance of chronic obstructive pulmonary disease symptoms. Symptoms of bronchospasm include shortness of breath, wheezing, coughing, and chest tightness. It was patented in 1983 and came into medical use in 1990. It is marketed as Serevent in the US. It is available as a dry powder inhaler, DPI, that releases a powdered form of the drug. It was previously available as a metered dose inhaler, MDI, but was discontinued in the US in 2002. What is salmeterol used for? Salmeterol is indicated in the treatment of asthma with an inhaled corticosteroid, prevention of exercise-induced bronchospasm, and the maintenance of airflow obstruction and prevention of exacerbations of chronic obstructive pulmonary disease. Contraindication. Hypersensitivity to any ingredient of the preparation. Should not be started in patients with significantly worsening or acutely deteriorating asthma. Not designed to relieve acute asthma symptoms. Side effects. Due to its vasodilation properties, the common side effects of salmeterol are dizziness, sinus infection, and migraine headaches. Other side effects. Muscle tremors, hypokalemia due to direct effect on beta-2 receptors on skeletal muscle. Pharmacodynamic. Salmeterol is a long-acting beta-2 adrenergic receptor agonist that binds to both the active and exosites of the beta-2 adrenergic receptor. Salmeterol has a longer duration of action than other beta-2 agonists like salbutamol. Patients should be counseled regarding the risks of long-acting beta agonist, LABA, monotherapy, hypokalemia, hypoglycemia, and not to take this drug with another LABA. Mechanism of action. Beta-2 adrenoceptor stimulation causes relaxation of bronchial smooth muscle, bronchodilation, and increased airflow. Salmeterol is hypothesized to bind to two sites on the beta-2 adrenoceptor. The saligenin moiety binds to the active site of the beta-2 adrenoceptor. The hydrophilic tail of salmeterol binds to leucine residues in the exosite of the beta-2 adrenoceptor almost irreversibly, allowing salmeterol to persist in the active site, which is responsible for its long duration of action. Another hypothesis is that the lipophilic drug diffuses into lipid bilayer of smooth muscle cells and provides a depot of drug to the cells over a longer period of time. Half-life. The half-life of salmeterol is 5.5 h. Dose. Asthma prevention and maintenance. Administer as additional therapy for patients currently taking but inadequately controlled on an inhaled corticosteroid, ICS, not for patients whose asthma is adequately controlled on low or medium dose ICS. 1 inhalation, 50 micrograms twice daily, not to exceed twice daily administration. COPD maintenance. 1 inhalation, 50 micrograms, twice daily, not to exceed twice daily administration. Prevention of exercise-induced asthma. Use as a single agent for the prevention of EIB may be clinically indicated in patients who do not have persistent asthma. 1 inhalation 30 minutes before exercise, a second dose not to be administered for another 12 hours, not for use in individuals receiving twice daily therapy of salmeterol. Safety advice. The FDA categorizes medications based on safety for use during pregnancy. 5 categories A, B, C, D, and X are used to classify the possible risks to an unborn baby when a medication is taken during pregnancy. Fluticasone/salmeterol falls into category C. That's all the information about salmeterol we collected. Thanks for listening. Do not forget to like, share, and subscribe for the xinafoate channel if you like this video to update more health information.